Good afternoon, I'm Andrea Albers. We are bringing you live to La Crosse County, where health officials are giving an update on the spread of COVID-19. The County Health Director, Jen Rambalski, is getting started. Let's listen in live.
The process that our nurses and disease investigation staff go through to speak with clients that might have confirmed COVID-19 or those that might have been exposed. So we'll talk about that. First of all, in the state of Wisconsin today, the current numbers are that we have 707 cases. That is an increase of 122 cases from yesterday. We also have 11,583 negative test results, and that is 1,494 higher than yesterday. In addition, we had 2 additional deaths. So we have 8 that have passed away in Wisconsin from COVID-19. In La Crosse County, we currently have 14 cases. I just got the 14th case in, so we have information on the 13th case, and I can share with you that that individual is in his mid-60s, so it's a male in his mid-60s with mild to moderate symptoms. The remainder of the cases all continue to be, 2 have recovered from COVID-19, and the others have not progressed to severe symptoms. They all continue to be with mild or moderate symptoms. So that is very good news in my opinion. So besides that, once Jackie, our public health nursing manager, comes on and speaks about the disease investigation and contact tracing process, I will come back and close out with some key links to information that I think would be important for individuals to be aware of. And then we'll, of course, as always, take questions and answers. So up next, I'll have Jackie Cutts. She is my public health nursing manager here in the La Crosse County Health Department, and she is currently managing all operations relating to the disease investigation process. Jackie.
Hi, my name is Jackie Cutts. As was alluded to, I'm the public health nursing manager and currently acting as the operations section chief for our COVID-19 response at the County Health Department. I'm really happy to be here today to talk to you about what disease investigation means and how that happens. So if there is an individual who's identified as positive, we are notified through the Wisconsin Electronic Disease Surveillance System or by one of our local healthcare partners. So we have really good relationships with them, and they clue us into those positive cases as quickly as possible. So we're talking hours, hopefully, and that way we're able to start the process really quickly. When we get that information, we make sure that the individual has been notified by their provider about the result, and then we have a conversation. That conversation with that individual can last up to 2 hours sometimes. It's really about understanding where the individual may have come in contact with COVID-19, and that's the same process that we take for all communicable diseases that are reportable to the health department. Once we understand more about when symptoms started and what those symptoms included, and when that individual may have come into contact, if we can identify that, then we talk about where the individual has been and what would constitute a close contact with other people. And what that means is that somebody has been within 6 feet of another person for an extended period of time, or who would have had direct contact with secretions from their body. So that's saliva or blood, things like that. We identify any people that we think could be at risk, and we try to be as inclusive as possible when we review that information. So if in the 48 hours before somebody developed symptoms, we knew that they were in direct contact with somebody in our county or in any other county for that matter, we reach out to those individuals and let them know. We are also in contact with other health departments across the state and in other states when required to make sure that they know about their people in their county who may have had contact with a positive case that's in our county. That allows us to provide really tailored information to people who may have a slightly increased risk. So we'll look at what did that exposure look like. Were you standing in the same place as somebody else for 5 or 10 minutes? Or were you, like a romantic partner of somebody who has been confirmed as having COVID-19? The different risk associated with those relationships, it's different. So we think about what is your risk level based on that type of contact. After we have that information, we contact anybody that we think could be at risk, and we say things like, we have identified that you may be at an increased risk for COVID-19. This is where you might have been in contact with that, if that's information we can provide. And then we talk about what you should do. That usually means staying at home and monitoring yourself for symptoms for a period of 14 days. And then if you develop symptoms, what should you do about that? So I want to get at the questions that we get at, that we have been asked a lot about why don't we tell everybody in the community where somebody has been. So think about it this way. 2 to 3 weeks ago is when somebody may have been in that location. That means that those locations right now from that particular instance aren't at risk. And what's better to think about is right now all the places that people we don't know who might be positive. Those are the places that we're trying to help people avoid by staying home. So what people can do right now to keep themselves safe and in our community is staying home as much as possible. And knowing that if you are thought to be at an increased risk for having had direct contact with somebody, the health department really does care a tremendous amount about each person that we could potentially see risk in. And we very aggressively, very quickly notify people as soon as we identify that they could be at risk. So you can trust that if in our very thorough investigation process that includes hours and hours of interviews, if we think that you're at risk, we will notify you as quickly as possible because we want you to have that information, and we really do care a lot about our population and making sure that you have the information you need to act the way that you need to. I'll turn it back over to Jen.
Thank you, Jackie. Appreciate that. I hope that that information is helpful. And please do continue to ask us questions. We really want to be a source of factual information for you. So utilize our Facebook page or send us an email through the COVID email address. That is lacrossecounty.org/COVID-19. That's the website. I'm looking for the email. It's COVID-19 at lacrossecounty.org. There we go. So please send us an email. We do want to hear from you. We want to provide you that factual information. I do want to give a brief update on some resources that have come out just today that might be helpful to members in our community, and we will make sure we'll get this on our website, so you can go to our website and look for that information. First of all, there are some plain language fact sheets about the Safer at Home order, so we would like to post those. They are available in both English and Spanish. There is some guidance for grocery, retail food operations following the Safer at Home order. In addition, we have guidelines for food delivery during this emergency order. So we'll post those links to our website. I also wanted to talk briefly about masks. So masks continue to be an important topic in our community. And I do want to say that we have received many emails from individuals in our community. We are working really hard to get the right information out to you. It wasn't quite as quickly as I hoped that it would be, but that's because we're working on a number of angles with that information. So by the end of today, we will have sent out an email to individuals that had contacted us, and that email will include a link to You Get Connected, which will be through Great Rivers United Way is going to be helping assist us in taking that volunteer need and helping them to know what to do with the masks. And then we're hoping to have a site by the end of the day as well that will be accepting those masks. So that information will all get sent out to those individuals that contacted us. In addition, we'll be posting that information on our Facebook and website. So we apologize for the delay, but we think that there'll be more information available. So do just kind of know that we're trying really hard to get that information out as quickly as possible. So just to reiterate, the role going forward for the health department will be, once we develop that guidance for the masks themselves and the location for those that are willing to make them to be connected to and where those should be distributed, we will only be providing information and will not be part of that coordination of masks. And just another reminder that if you don't have all the materials you need to make the masks, this would not be the time to go out and get those materials. We do not consider that to be essential travel. So we appreciate very much that willingness and passion of those in our community, many in our community who are willing to do that. But it does need to be a coordinated effort. So we appreciate your patience with regards to masks. With that, I think I will take questions.
We have a lot of people who understand how much information you guys are getting and appreciate how you share it. And then there are also people who have a lot more questions and listen to the rumor mill, and they're not sure that you guys are sharing all the information you know. What's your message for them?
My message for them is that one of my top priorities always has been and always will be transparency. So of any health department leader, I would say it is very important to me and my team as well that we share whatever we know when we can share it. So there are some things we cannot share, and we've talked about that. For example, anything that might be confidential that would help identify an individual. There are many reasons for that. But for the most part, we're absolutely working very hard to get the information out that needs to be received by our public. So I really want people to know that that is a top priority for us, in addition to the contact tracing and communications with individuals to make sure that we're limiting exposure. Those are the two top priorities that we're working on right now and have been for weeks. So just know that that is absolutely our priority. Please contact us by email, Facebook. We want those communications. We have a call center. I think that tells you that we want to hear from you. We are hearing from many individuals. We want to get the response to your question as quickly as possible.
And how long do you think you'll keep doing these briefings?
I think that as long as we feel there's something important to share with the public, we will keep doing these briefings. If, for example, our cases are not increasing or there isn't anything that's really critical to be sharing and we can do that through Facebook and our website, then maybe we'll decrease from daily to 3 or 4 times a week. But I think as long as it's important for us to be getting information out, we're going to continue these daily briefings.
With the confirmed case at a train company that could have exposed a lot of other people, what are you telling manufacturers that continue to kind of work and be processed?
Great question. I actually just last night had a conversation with someone who is leading a manufacturing company. And first of all, those that are trying to be good leaders in that industry, I really appreciate. There are many of them out there. I would say to them, first and foremost, you need to have a very good process in place to assure that individuals who are working for you are not coming in with symptoms, and that as soon as symptoms are identified, whether you know it's COVID-19 or not, we know that many people don't need to get tested to know what to do, that those individuals would be sent home immediately. And I would encourage that there be a process in place to make sure that coworkers can report that without retribution. It's critical that employees feel safe. We do not want to have situations where individuals who are working for a business don't feel safe working there. And that is the case in some businesses across this community right now. So first and foremost, we have to be sending people home and not allowing them to come in when they are ill and have symptoms. Secondly, we do know that the virus can live on inanimate objects. We just don't know how long. So I think it is important to have a very solid cleaning process in place. And when you have been identified as a facility to have a positive case, we need to look at where that individual works and what facility portions they work in. It doesn't mean you need to shut down every building across a particular type of company, but it does mean you need to shut down certain portions to assure that you can really clean very well so that we're not potentially exposing through inanimate objects. So those would be the top 2 priorities. And then I think if they have questions about what other things that they might do to help protect their workforce, contact us. We have individuals who are specifically focused on businesses and having communications with businesses.
And have any of the confirmed cases been from somebody who's recently come back from a spring break?
So of the cases that I mentioned today, no. Not that I'm aware of. In fact, the 13th case that I mentioned did not have a history of travel, nor did they have a history of contact with someone who had confirmed COVID-19.
What about the others?
That 14th case I don't have any information on yet, and I don't have any knowledge of any of the other cases that were spring break returners.
Hey, Jen, can we just get you to repeat the question?
Oh, I'm sorry. I knew that. Okay. Yes, I will do that.
Does that mean that the 13th case was community spread then?
So the question is, does that mean the 13th case was community spread? Yes.
We're getting some questions about maybe parents who are divorced. What is your sort of thoughts and opinions on maybe going parent to parent? Is that something that is allowed? Or
So the question is, with the safer at home order and how to handle this with parents who are divorced or separated, with situations where children need to go from home to home. That is a really difficult question. We're getting that a lot right now, and we have been hoping for some guidance from the state. I heard yesterday on the Health Officer Forum that they were going to be getting something from Department of Children's and Families at the state level. So we haven't received that guidance yet, but I think for now, our guidance would be that we just want to be really careful with movement wherever possible. Those situations are quite varied depending upon the relationships in those situations. So I think if there is a way that we don't need to be moving frequently from house to house, that would be ideal. But in particular situations, if there, for example, is someone in the household who is symptomatic, it would not be a good idea to potentially move someone in the household who is supposed to go to a different home for a time period, who may have been exposed to those symptoms, to be moving to a different household and potentially spreading the symptoms. So keep in mind how this virus spreads, and certainly we'll try to answer your questions as they come in, but we are looking for that guidance to come out from the state soon.
I know you said we have 2 recovered cases.
Mm-hmm.
Are you able to say if those were the first 2 confirmed cases in La Crosse County?
I'm looking at my public health nursing manager. Were the first 2 cases the ones that are recovered?
I do believe that that is true, but I can confirm that.
So we think that that is true, but we'll confirm that.
Would you mind kind of reiterating maybe the importance of really staying calm during this? I think, as I was just going out in the community maybe a couple days ago or like a day ago, I saw a family playing in the park when there's a sign that said no, and another pedestrian walked by and was kind of yelling and hollering, and that doesn't really help the situation either. I guess can you maybe just reiterate why it's important to stay calm, especially in these kind of moments?
So the question is reiterating why it's important to stay calm. Right. Your example about the family in the park. I saw an individual playing tennis with another individual in the park. And, what we can tell people is that getting outside is important. Getting physical activity is important. But I had to check that through my own head. Playgrounds currently are closed, but parks are not technically closed. So I think it is important to balance, however, between getting outside to get some fresh air and some physical activity and not being in close contact with others such that we might be spreading the virus. So it is hard to trust that everyone is doing the right thing, but it is also not necessarily, it is not helpful to be angry or to be like you said, yelling at someone else for the actions that they're taking. There is a process for that. If we think a business is not essential and should be closed, if we think individuals are gathering in groups bigger than 10, we have a process to follow for that, and that isn't yelling at people. That's why we have law enforcement. So I just think it's important to remember that kindness is really critical in a time like this. So it is about being calm, but it's also about being kind and remembering that these are our neighbors and our friends and our family members, or a friend of a family member. And it's difficult for many of us, but the emotions that we have, if we don't get them in check, we can be causing unintended consequences that we're not aware of.
For the recovered cases now, are they able to go out, or what's the status of them after recovery?
So I'll just touch on the particular details about someone who has had COVID-19. When they are considered no longer infectious, when they have been 7 days from the date that their symptoms began, and they are 72 hours symptom-free. So that is what we use as a determination for being able to no longer be infectious to others. So your question about going out, again, I would just say, could they then go do essential travel to the grocery store? They could. In terms of those 2 cases, do they meet that definition? They do meet that definition is what I'm getting. So yes, they are no longer considered infectious.
One thing I wanted to kind of ask too is, I know this time of year as well as in the fall, people usually come down with allergies, and I think if people see people coughing or sneezing, they might kind of get that a little bit confused. I guess what would you say about that with people who do suffer from seasonal allergies and stuff, that may show some of those symptoms and unfortunately can't really help it.
Yeah, so the question is, if you're out and about and you see someone who might have symptoms that are associated with seasonal allergies, but they look like COVID-19, right? I think we need to remember that the virus does not discriminate. We should not discriminate. We should not stigmatize. We have to have some level of trust that individuals are doing the right thing. And if someone has allergies, if you were the person with allergies and you knew that you had a cough, I know of individuals who've had a chronic cough for months and it is not associated with COVID-19, and now individuals look at them in a different way, and that is stigma. So we need to be really careful with stigma, recognizing though that we do have to balance our own safety. So in those situations, you need to just keep your distance. That is the time for social distancing.
The questions on Facebook about the shelter in place and if we feel like it's working or if it's too soon to tell.
So the question is shelter in place working? So one of the things that when I look at this particular safer at home order, in my own opinion, I believe that we needed to have this order. We need to assure that we are doing everything we can to decrease the spread. We have 14 cases. Gratefully, that is not much higher, but it could be. And we see in even our own state, the southern and southeastern parts of our state, having a higher number of cases. And if we did not have this safer in place order, people would still be moving frequently throughout communities across Wisconsin and beyond. We are a very mobile society. So I think the safer at home order is really important. I don't yet know the extent to which it will be impactful in the ways that we want it to be. It is way better than no safer at home order, but there are a number of exemptions that still allows for quite a bit of movement for particular locations that are determined to be allowable or exempt under the order. So I think we all continue to have to take very close precautions with regards to, if I'm an essential worker, I still need to practice precautions if I need to go to the grocery store, just like everyone else. I need to make sure I'm 6 feet away from others and I'm social distancing when I go there. I need to make sure that I am not touching my face while I'm at the store when I might be touching contaminated surfaces. So just because we have this order does not mean that we are not at risk. We still need to take all of these same precautions, and remembering that we should not be out frequenting these locations just because it's okay and considered essential travel.
Jen, I'd like to get your thoughts on, do you think law enforcement should be enforcing the sort of stay at home and making sure that these people really are essential travelers? Because there's still quite a bit of people out on the streets. So your thoughts on maybe law enforcement enforcing this?
Sure. So my thoughts on should law enforcement be enforcing individuals staying at home, because I can tell you that law enforcement is enforcing those that are maybe not essential businesses that have not closed. That has been happening in our community, and very successfully. As far as individuals goes, it's a balance, just like everything is. So when we look at the breadth, the bandwidth of our law enforcement, we don't have the bandwidth necessarily to be, stopping people on the road to see if they're out and about for the right reasons. We all can take those precautions to make sure that if we're really out there, it's for a reason. And I think many people in our community are checking that very carefully with themselves. And for those who are not, the likelihood that we're going to stop that particular individual and have the ability to do that, probably not likely, and we just can't reiterate enough how important it is that we're all doing our part.
One more question just regarding the investigation process. How do you go about finding people that have had contact with someone who has symptoms? How does that process?
Sure. So the question is, how do you find people who have had contact with someone? So I think what this question is getting at is, so I'm talking right now on the phone to an individual who has been lab confirmed with COVID-19. How do I figure out, I've got the names of individuals they might have been in contact with. They give me the phone numbers, the addresses. How do we go about connecting with those individuals? We are really, really good at this. So I'll just bring up, we do sexually transmitted disease investigations, and if we can get to those kinds of partners, we can certainly get to the individuals that that we're getting names and addresses and phone numbers from with individuals that have had connections. So we have the ability to do that. We do routinely get good response. So if we call someone, we leave a message, we get a phone message back, we connect with them. If it's by email to say, this is someone from the health department, please contact us back. If it is by, address and having somebody, perhaps, go and contact them at the home. I don't know that we've used that to this point. We're in a safer at home order, so we don't really want to use that mechanism, but we're very successful with that.
If someone came down with COVID-19 and then they recovered, can they get it again? Can they be reinfected?
So if someone comes down with COVID-19, can they get it again and be reinfected? We do not 100% know the answer to this. What we know is that typically when we're infected with a virus or a bacteria, our immune systems, if it's functioning properly, will respond to that infection and will build up antibodies so that we're able to fight it off in the future. But these viruses change routinely, and if the strain changes, then it's possible that that could be a reinfection situation. So we just do not know yet that level of potential for reinfection.
How are you doing?
How am I doing?
Yeah.
I think I'm calm. I hear from a lot of people who say that I'm calm. So I feel good. I feel really strong about our team. We are just working so hard to serve the community. This is what we do. People probably didn't know this is what we do. So it's nice to be able to help others and hear from them that is helpful. We are every day identifying areas that we might be a little concerned about, and we're addressing those as soon as possible because our job is wide, and we need to make sure that we are doing our best to motivate others to do their best, to protect our healthcare workers and protect our law enforcement and fire workers, and make sure that EMS is not being inappropriately exposed when they respond, and make sure that everyone in our public is doing the right thing. So, thanks for asking. Okay, thank you.
And that concludes another daily briefing from the Crosse County Health Department. The director, Jen Rumbalski, speaking there, updating the community about the number of confirmed cases. 14 confirmed COVID-19 cases now in La Crosse County. That's 2 additional cases from yesterday. It includes a male in his 60s. The other case, the health department is still working to gather information on, and we were given some insight into how the health department does what they call contact tracing the exposure of those who do have a confirmed test. We got some good news here. 2 people who had the virus have since recovered, and no one with the virus has had symptoms serious enough to land them in the hospital. 2 good news items there. Of course, we will continue to update you online at wxow.com/coronavirus, and our live local coverage picks up tonight on Live at 5. Thanks for watching.